Good morning. Good morning. This is Dr. Heather Stanley Christian, Director of Unity Maternal Fetal Medicine. I help women with complicated pregnancies figure out an individualized plan of care for them. So today I just wanted to answer a few questions surrounding the use of ultrasound in pregnancy. I get it a lot, and so I picked out about 3 questions that I'm going to go through. So the first question is, what is it? What is an ultrasound? Is it an X-ray? No, an ultrasound does not employ radiation. It employs a physics principle of sound waves bouncing off of structures of different densities and translating those echoes into images. So when the probe is placed on your tummy, it passes these high frequency pressure waves through your tissues, which are then reflected back to the probe and results in the images that we get. Now, as a maternal fetal medicine specialist, we have 2 patients: the baby that we can't see, touch, or examine, and the mom. So the ultrasound is a nice way for us to look into the pregnancy for moms and or babies that have high-risk conditions and to continue to assess fetal well-being. Another question that's asked is, why are some fetal scans so quick? The general answer is it depends on why the ultrasound is being done, gestational age, and the questions that we're trying to answer. So I'm going to answer this question surrounding the anatomy scan, which is around 18 to 20 weeks. Those of you who might know it as a gender reveal ultrasound. There are 3 types of ultrasounds. One is the standard ultrasound, formerly known as level 1. Then you have the specialized or the detailed or the targeted ultrasound. Those descriptors are interchangeable. Though that was formerly called levels 2 and 3 ultrasounds. But we really don't use that designation of level 1, 2, or 3 anymore. But so you have the standard number 1, you have the detailed, and then you have the third one, which is the limited ultrasound. The limited ultrasound is usually when there's a specific clinical question that we need to answer. For example, if a mom came in with complaining of leakage of fluid, and it's not clear cut that the membranes were ruptured, then using the ultrasound to assess the amniotic fluid volume may point us in the right diagnosis and possible treatment. The standard, see, habit. The standard ultrasound is usually offered to women with very little or no risk factors. The specialized or the detailed targeted ultrasound usually offered when abnormalities are suspected or pregnancies are at high risk for fetal anomalies. An example could be a mom who has seizure disorders that are controlled by one or multiple medications. She would be a candidate for a specialized, detailed, targeted ultrasound because the exposure of the fetus to the medication could give us information about how the baby has developed under that exposure. Are ultrasounds safe in pregnancy? Yes, absolutely, within reason. If you're doing ultrasounds 5 times a day, 7 days a week, might not be a good thing. But if we look in nature, the use of the ultrasound waves is not a new phenomenon. There are animals such as dolphins, whales, bats, porpoises. They use the physics of echolocation to see in their environment. When the Titanic first sank, just around World War I times, the French government unsuccessfully tried to find the lost Titanic. That was the first time they tried to find it, and they used echolocation. Because of that, echolocation has, morphed into several uses. It first came into play in obstetrics in 1958 when Ian Donald was the first to diagnose twins in utero, and that was back in 1958. The general principle of safety for ultrasounds and for any technique that employs imaging is to use the ALARA principle, which is an acronym, which means whatever we're doing, do it as low as is reasonably achievable. So what that means is when we're doing the ultrasound in the moment, we are using pressurized sound waves. So our acoustic output metrics should be monitored closely. Those are the dials on the machines for which credentialed ultrasonographers would know how to minimize your TI and your MI, and get what needs to be obtained in a low manner that's reasonable, achievable. That safety may also be employed as not using pulse wave Dopplers too much in the first trimester, leaving that to the specialists to do, and only using it when necessary. How many ultrasounds should be done in pregnancy? So many factors determine the frequency. If you're in the first trimester, a dating ultrasound is very helpful, incredibly helpful, because if you're in the third trimester and there are concerns about the baby's growth, the first trimester is the ultrasound that sets the due date, confirms the estimated due date by your period. Under select conditions, we can do an anatomy survey, not complete, that can be done ideally between 12 to 14 weeks, to assess critical presence or absence of structures. In the first trimester, the nuchal translucency can be employed as a screening modality to lower what we call the a priori risk. That is your age coming into the pregnancy that may be at risk for trisomy 13, 18, or 21. A point of privilege. We're fluid, we're traveling to states, we're moving, we're visiting relatives. Sometimes you don't know you're pregnant, or you're pregnant and there may be a problem while you're visiting. And so you end up in an urgent care facility or the emergency department, and they may perform an ultrasound. I'm going to ask you to please get a paper copy of that ultrasound report so that when you return to your home state and your provider, that information can be given, because it can be incredibly helpful in planning the rest of the pregnancy in terms of dating, because we wouldn't want to plan a delivery for a baby that's not the gestational age that we think it is. The second trimester, A mom may either get the standard ultrasound, which is when there are no issues, or a detailed ultrasound if there's a suspicion for abnormalities or the baby is at high risk for fetal anomalies such as advanced maternal age. The third trimester timing depends on several factors. It is assumed that an ultrasound was performed either in the first or the second trimester. We can do dating ultrasounds in the third trimester, but it's extremely difficult and it's fraught with uncertainty. But the third trimester ultrasound is usually done to monitor fetal growth. So how many ultrasounds should a person have? That's hard to ascertain. It's individualized. However, as a general rule, if you have no risk factors, then a minimum of 2. 1 in the first trimester, a standard ultrasound in the second trimester, and then depending on what's going on in the third trimester, you may be done with ultrasounds or you may have to revisit an ultrasound. When should an ultrasound not be performed? The answer is when the patient declines. There is no absolute contraindication or relative contraindication to an ultrasound, except when the patient demurs on the procedure. We can, as healthcare providers, we can use that as an opportunity to question, probe, and educate under that circumstance. So in summary, ultrasounds are generally safe in pregnancy. They have helped us to decrease fetal mortality and morbidity, as well as maternal mortality and morbidity since 1958. It should only be used with the order of a physician using the ALARA principle. Persons who are obtaining the images who are not licensed medical providers should be credentialed. Supervision should be by licensed medical providers who meet specialized training guidelines, and they are readily available to interpret the ultrasound examination. One way to minimize excessive ultrasounds is to have a planner, especially for my ladies who are going back and forth between their OB providers who are doing the routine care. And sometimes routine care for their practice does include ultrasounds periodically. But then you're also visiting the maternal fetal medicine specialist, and we use the ultrasound to do an examination on our second on-scene patient. So planning and coordinating teams would be incredibly helpful and also quite cost-effective. Next week, we're going to tackle diabetes complicating pregnancy. Whether you came into the pregnancy with diabetes or you developed diabetes during the pregnancy. So I'd like to thank you for spending the time with me. I'd like to thank you for listening. This is Doc Heather with Unity Maternal Fetal Medicine. Our brick and mortar office is in the Claremont, Florida location. So if you're in the Orlando area, Winter Garden, Leesburg, Ocala, surrounding areas, please give us a call. We do provide standard ultrasounds. You don't have to have complications to come check us out. We have lovely equipment. Self-referrals are always welcome. Sometimes you haven't quite figured out who you're going to for a provider, an OB provider. Sometimes insurance limits where you're going or where you can go, but you want to know about your dates. You want to make sure that the baby is structurally normal. We're happy to help you navigate that. At a very minimum, do that standard ultrasound, give you the report so that when you establish care, you'll have that with your to give to your provider. Thank you again. We would love for you to have a wonderful and a curious day. Please walk your path with Unity. Our website is unitymfm.com. Our Facebook, Unity Maternal Fetal Medicine. And on Insta, we are Unity MFM. Have a wonderful day.